Welcome back to Talk of the Town, and I'm here today with Dr. Luke Curtsinger from Coastal Empire Plastic Surgery. Luke, I'm so excited to have you here.
It's great to be here.
Thank you. And today I'd love to talk a little bit about something us women, 50-ish or so, would like to know a little bit about, and that's facial rejuvenation.
Sure. Very popular topic.
Yes, I would think, especially with the spring now, I would imagine that's probably a pretty important topic for the women.
Actually, it's important all year long.
Okay, good. Yeah. All right, tell me a little bit about what exactly your practice does with facial rejuvenation.
Well, we do all forms of plastic surgery, non-surgical and surgical. I guess you can break down facial rejuvenation into 5 different areas. Changes in texture, color, volume, sagging, and abnormal muscle motion. And certainly the #1 cosmetic procedure in America involves abnormal muscle motion, and that's Botox.
Okay.
Botox and Dysport, another new competitor for Botox. We're using both of them. Both of those are used for excess wrinkling, most commonly in the forehead as well as in the crow's feet, and lots of other areas in the face, but those are the 2 most common.
Right. I have not heard a lot about Dysport, although I've read a little bit about it. And how is it different than Botox?
Well, it's a different company,
okay.
And for a lot of people, it's like Coke and Pepsi. You know, one
right.
works just as well as the other. I think that Dysport can be a little cheaper for some people, and for other people, no, they need that much more Dysport. So they are equivalent in many ways, but they are 2 different products from 2 different companies, and so it needs to be tailored for each individual.
Okay, and then there's also other areas that fillers are used in that it's not Botox, correct? You use different fillers for different areas on the face.
Yes, we also have in the filler category, that's to restore volume.
Okay.
Very frequently we use Restylane and Juvederm and Sculptra and Radiesse are probably the most common off-the-shelf fillers, and then there's using your own fat, which is really a very hot topic in plastic surgery, that we can take someone's own fat and transfer it, sometimes as a permanent fat transplant.
Okay, and that would be like in cheeks, chin, things like that?
Cheeks, and in everything.
Okay.
In cheeks and chin and lips and forehead
wow.
and temples and just
okay.
about everywhere that you might need it, because we've learned that as we age, that's one of the areas where people normally age, is that they lose volume as they get older. So restoring volume in the right places makes you look younger and smoother.
Okay, and is that a huge surgical procedure in removing the fat and putting it back in other places?
It's a pretty small surgical procedure.
Okay.
The biggest problem is you have to set aside a little time to be swollen for a week or 2, but then other than that, it's a great deal.
Okay. Are there incisions with that procedure?
Actually, it's little tiny needle holes. They're very small.
Okay.
So you can go just about anywhere, but they're tiny and they're gone in a few days.
Wow. Wow, that's terrific. And what about, do you find a lot of people looking more towards the surgical side, where they're actually doing face lifts and things like that?
Well, absolutely. I mean, that's part of the 5 different things that as we normally age, and we're all tempted to sort of go for the easy thing,
right,
and take the quick and easy, and you can beat the quick and easy thing to death.
Right.
There is, the good news on facelifting is that it's gotten a lot easier.
Okay.
It's a shorter procedure. The incisions are much smaller than the grand old facelifts that I used to do half a dozen years ago. And so the recovery time is quicker, and the scars are shorter, and the results are just as good or better.
Right. If I read correctly, it used to be that you would almost go completely around the face to do including areas around the ears, behind the ears, in order to pull the neck and stuff up. Now,
right,
it doesn't require all of those incisions?
Right. It's gotten much shorter. It's just hidden in the sideburn and down behind the little tragus of the ear and down to the bottom of the ear. We were able to do the whole facelift through a very short scar incision.
Wow, that's amazing. That's just amazing. So do you find a lot of people that will use the Botox and some of the fillers and then it just stops working? Is that what kind of happens?
Well, it's just that we can only treat muscle motion with Botox, and we can only add volume with Restylane.
Okay.
And sometimes we need a color correction or texture correction with maybe a chemical peel or some skin care or some of our non-surgical treatments like the Trinity, or there's also the Fraxel and the Thermage that have been used. They help with color correction and texture.
And that's a laser procedure, Luke?
A laser or non-surgical type intervention, yes. And but then there are some people where all that stuff can be done, and you still have sagginess, and you have to correct it.
Right.
So at different times in different people's lives, any one of those things might be appropriate.
What right now, being that it's spring, is maybe a larger area of interest for people?
Well, spring is always bathing suit season,
okay.
And so that is a time when we see a lot of body contouring and breast procedures. Everyone thinks of breast augmentation when they're headed off to the beach, and those women who don't think they need breast augmentation, very often they might need a lift or a reduction. Whatever it takes as the season gets warmer to feel more comfortable in less and less clothing, or whatever you're comfortable with, obviously.
Right, and I really want people to know that where you're located. I mean, your primary location is in Savannah, but I want them to know that you come over into Hilton Head and service this area. So just tell me exactly where the two different locations and how your hours operate.
Yeah, well, our office and surgery center in Savannah, near St. Joe's Hospital, but I am over in Bluffton on most Mondays, right in Sheridan Park. I'd say conveniently located right in front of Custom Audio Video.
Yeah, exactly. I love that part. Very close to me, Luke. You make it very tempting. But yeah, that's terrific. So people can just make an appointment for a consultation?
Sure.
Is that how you start?
Absolutely, yes. Everybody's different, and I think probably one of the things I'd like to emphasize in my practice is that I like to listen. And that's important to understand what any individual patient's goals are. If we are going to have a happy patient, we have to hear what they have to say and what's important to them.
Right.
So yes, an initial consultation is extremely important, and because one size never fits all.
Right, exactly. And so from the consultation, then you set up their appointments, and you have the surgery center right in your offices in Savannah. Am I correct?
Yep.
And it's basically either same day or one day surgeries?
Yes,
okay.
yes. There's overnight stay, or a lot of patients, probably 80% of patients are done as an outpatient where they go home the same day.
All right.
But then in our Bluffton office, we're able to do initial consultations and before and after surgery things, as well as a lot of those non-surgical procedures like Botox and fillers.
Okay.
We're able to do there, and also take care of a lot of little skin cancers and small things like that.
All right. And how do they get a hold of you, Luke?
Well, our phone number is 888-920-2090, and we have a website, coastalempirePlasticSurgery.com.
Okay. And so that's terrific. I mean, that's some good information, and it's great that you're here on the island a good deal of the time. And obviously, the people that are interested in any of this can even just call the office. Is that
absolutely,
okay?
absolutely.
And there's somebody there that can give them a little information.
Sure. Yes, we answer the phone 24 hours a day, but certainly our best information comes during business hours.
Right. And then once they make the appointment, they actually see you, correct?
Yes, absolutely.
Okay, great.
Absolutely.
Great, that's terrific. And I'm excited you were here with me today, Luke. And again, please, if you get the opportunity, he's in Bluffton, and it's Dr. Luke Curtsinger, and we'll be back in a minute with Talk of the Town.